New report came out by the Commonwealth Foundation Fund. This is a big, it's like the top like healthcare think tank in the country. There's some highlights here, or lowlights as it were. Healthcare spending, both per person and as a share of GDP, is far higher in the United States than other high-income countries. Yet, we're the only country that does not have universal coverage. We have the lowest life expectancy at birth, highest death rates for avoidable and treatable conditions, the highest maternal and infant mortality, the highest suicide rates. We have the highest rate of people with chronic conditions and obesity, nearly twice the OECD average. And here's the amazing thing. Americans see physicians less often than people in other countries and have among the lowest rate of practicing physicians and hospital beds per 1,000 population. So we pay more.
And look at that.
For less. All right, let's start with this.
The healthcare spending one?
Here's the healthcare spending.
Yeah.
Look at this. Ours is way, way up there. What's interesting is that it goes down recently. And I wonder if that's not a function on some level of of so many people getting on Medicaid during the pandemic. I'd be curious as to what that's about. It's fascinating. And part of it is also, we know that there's subsidies in the Obamacare. Now understand, this is both public and private outlays combined. So this is the argument that you hear when Bernie Sanders would say it's going to cost more for the government. Obviously, I've seen estimates at $2 to $3 trillion extra a year in terms of health insurance outlays, but that's still significantly less than people are paying in private sense.
It's 17.8% of U.S. GDP as of 2021. And the next closest is the UK at 11.9%. They have issues with their healthcare system too, but like their model is something that perhaps the United States could at least borrow from some elements of it. And that's just like, I mean, that's a significant drop off. Everyone else is comparable there, right?
Yeah, the next highest is Germany and France.
Oh, Germany, sorry. That's not
at 12.8%. I mean,
yeah.
we got a 5% more in terms of our percent of our GDP. And on dollars, we're twice as much. Go down, go to the next one. 3 to 4 times more on healthcare than South Korea, New Zealand, and Japan we spend. We spend, I don't know, 35-40% more than Germany, which is the next closest. You can see both are out of pocket. Out of pocket's a little bit less than Switzerland, but our government expenditures twice as much.
And in terms of out of pocket as well, like we'll see later, people are going to the doctor a lot less.
Yes. And we should say that the blue lines here are not just government, but also like health insurance. So it's private on both sides. It's just like, how much do we pay like with co-payments? And it's higher than everywhere else except for Switzerland. They're all bankers there. Go ahead. Go to the next one. It is the only high income country in the world that does not guarantee health coverage. I mean, I don't know what to add to that. You can see that like the blue is some type of like compulsory or government sponsored health insurance. Everybody gets to 100%. We get to like, I don't know, 38%, I guess. And not even, because that's 38%. 38.1 is the government compulsory health insurance relative to the private. But they have different levels of private. I mean, if you look in Switzerland, 100% government compulsory health insurance. And then they have like additions. In UK, same thing. This has to do with what percentage of the population has private and public. 100% have public access. In UK, 10% have, I guess, private. voluntary insurance. So they all have, and then you have like Japan, Norway, Sweden, where they're like, we don't even have private insurance.
What's that?
Don't need it.
I do not know her.
Don't have this voluntary thing. We don't need that. We are already taken care of. Keep going down. And then we get to the outcomes part of this equation, which is equally as embarrassing. The U.S. life expectancy at birth, 3 years lower than the average of the OECD. That is the organization. What is it? That's basically European countries and really basically industrialized countries that have are developed that we consider. Now, there's two things that are working on this in terms of U.S. life expectancy at birth. Well, one thing that's working at birth is that the big thing is, well, there are two things. One is that we have the highest rate of infant and maternal mortality in the OECD. So at birth, your life expectancy is 3 years lower. But it's not just at birth. Pop up that other one. They didn't have this in this chart, but pop up the other one about life expectancy at age 65. If you look at that, U.S. is way down. Go scroll. You see where U.S. is? It's down there, right just above Estonia, below Colombia. For men and women, there you should see. The men are in the diamond, and the women are the dot.
Our heads are blocking a little. Just scroll down a little. Yeah. There we go. Boom.
And that's men and women. And you have Japan and Korea and Spain and France and Switzerland, Australia, Luxembourg, Italy, Sweden, Finland, Belgium, New Zealand, Chile, Canada, Iceland, Ireland, Norway, Israel, Portugal, Costa Rica, Slovenia, Germany, Austria, Denmark, Netherlands, Greece, United Kingdom, Brazil, Colombia are all doing better than the United States in terms of life expectancy after the age of 65. So, in other words, you get to be 65. How long do people live after that? And if you were to break this down in terms of income too,
oh boy,
it'd be nuts. It would be nuts. Our outcomes suck. That's the other part of this. It's one thing if you're out there spending twice as much as any other country on health insurance, on health care, and you're getting somewhat better outcomes, significantly better outcomes, proportionate to what you spend outcomes. But no, our health outcomes are worse. Go back to the other one in terms of infant and maternal deaths. Next one down.
Both.
Well, avoidable deaths.
There we go. Yeah.
Per 100,000, higher in the in the U.S. than OECD.
336 per 100,000.
That is presumably health deaths that are avoidable. Not 100% sure how they define that, but nevertheless, we can see this data broken out in other places. Scroll down.
No one's even close with 200 per 100,000.
We have the highest rate of infant and maternal deaths. What's the point? What's the point of having the wealthiest country in the history of the world? We can't keep babies and mothers from dying at birth.
I mean, I would also like to see that broken down by income and race, because we know that black mothers, black people who can get pregnant, give birth, have much higher maternal mortality rates.
I mean, it's crazy. We have almost one kid per live births. Dies more than the rest of the OECD. And in terms of maternal rate, we have 10 mothers who 10 more mothers per 100,000 live births who die. It's crazy. Go down to obesity. We have higher rates of suicide. We have significant higher rates of death from assault. The obesity rate is nearly double the OECD average. And of course, when you contemplate the idea that we see our doctors have a distant relationship from our doctors, and the way that our food systems work, I mean, it makes sense.
It's also probably informed by the chronic conditions we'll see, I think, on the next chart as well, which can include diabetes and things like that. Right.
We are most likely to have multiple chronic conditions in this country. These are all just health outcomes, folks. And then here, we're getting into COVID. We have, and this is going to be nuts. This is going to seem absolutely insane, folks, to you, because we know that we have been told that the reason why we are being told by some of these peaks, the reason why people are dying of COVID is because they got vaccinated. But weirdly, U.S. has the highest rate of death because of COVID-19 anywhere else in the world. And then scroll down to the next one. Keep going down till we get to one more. Yes.
Influenza.
We have COVID-19 vaccination rate is still lower than many of our peer nations. In other words, we have the highest rate of COVID deaths. But even though we have been told by a lot of people out there that the COVID vaccination is causing this, we have a lower rate of COVID vaccinations. In fact, we are just below the global average. Sweden, Norway, UK, Germany, France, New Zealand, Canada, Australia, Japan, and Korea higher than us. Netherlands and Switzerland just tied with us, just about. Go back up to the visiting the doctors, too. Yep. One more. I think there's one more, right?
No, that's
okay,
it.
There it is.
Yeah.
We also have the lowest rates of physician visits and practicing physicians.
One of them, but yeah.
I mean, not quite the lowest.
But lower than the average by a significant margin.
And that's a function of, A, the cost to go see a doctor. And that's a function of how many practicing physicians we have, because that business has basically become overrun with bureaucratic red tape from the insurance companies and huge expense on the front end. So there's two solutions to that. One, you take the middlemen out of providing health insurance and just have the government do it with no profit motive. And two, you fund people going to university. It's pretty easy.
Mm-hmm. So there isn't, say hundreds of thousands of dollars in debt that you might have to accrue to become a doctor.
Right. And then you only provide, you only provide health care for people who can pay exorbitant fees.
Yep. It's absolutely insane. And I just keep coming back to in the Democratic debates when in 2020, discussions about Medicare for all and things like that. And there was a lot of rebuttal about, well, if you love your plan, you can keep it, right? Medicare for all who want it. Who the hell loves their plan? And then sometimes they'd say, well, if you love your doctor, you can keep it. I'm sure there's people that love their doctor. I get it. In the United States, we don't have people who can even see their doctor. People can't see a doctor because they can't afford it. There's not this deep connection that a lot of people have with their physician, because a lot of people just don't have a physician. They'll go to a minute clinic or they can't afford to go see a doctor at all.
I don't think there are a lot of people who love their plan, but I do think there are a lot of people who are afraid that it could get worse. which is not an unreasonable fear based upon, because we've never had a situation where they've gotten better until you get on Medicare.
Right. Exactly.
And the part of the other problem is, in terms of like educating people on this, is that, you know, something like 80% of our healthcare costs are borne by 20% of the people. You don't know that you have a shitty plan until you really need it. And I mean, I am less like, frankly, like, I have become less concerned with like those Medicare for those who want it. Like, okay, it won't take long until people realize that it's there. And as long as you force all physicians to take Medicare patients, that if you were to put like a cap on or a minimum of a certain percentage of your patients need to be Medicare, if it's a Medicare for all or Medicaid, whatever we call it, certain percentage of your patients, 80%, I think there are ways of getting around the need to get rid of private insurance, because we see plenty of places around the
but the funding mechanism from taxation has to be universal,
without a doubt.
I mean,
Just like
no bullshit. Like you get to opt out because you're a part of a private plan.
No, of course not. I mean, it's like public education. You want to send your kids to private school, you do it.
Right.
But still got to pay your taxes. And how do you do that? Asks Adam from What's the Punishment Violation Fee?
What do you mean?
Your reimbursement rates for Medicare are less, or you lose your license. I mean, it's pretty easy.
Yeah.
We have all sorts of ways of making sure that doctors don't do bad things.